Hey, future nurses, Rachel Taylor here, and today I want to talk about an important topic: what to do when you have failed your NCLEX exam. Not passing the NCLEX can feel heavy, but it does not define you. It does not define your future as a nurse. This moment is not the end of your story. It's just a pause before we get to that next chapter. Every nurse has faced some type of struggle. Whether it is in nursing school, whether it is to pass the NCLEX, whether it's in the new grad period. What matters most is what you choose to do now. Some of the big things that I recommend is just a perspective shift. Failing the NCLEX is not a reflection of your worth or your ability to care for clients. Nursing is built on growth, practice, and learning from challenges. This is just one moment in a much longer journey. I also want you to seek some clarity through reflection. You can use your candidate performance report as a mirror. Let it show you where you shine and where you need to focus more. And then lastly, the third big tip is we're going to make sure that you have a fresh plan going forward. Passing requires strategy. Now is the time to create a plan that is tailored to your gaps. And I want you to truly think of this reset as a chance to study smarter, not necessarily harder, but using tools like targeted practice questions, case studies, and tutoring to support and guide you. Setbacks often push us to become more intentional, and this is your moment to really step forward and walk through how to create a plan that's going to fit your unique needs. So first, I want to take some time to talk about common reasons for failing and really how to reset your mind. So let's explore why some of us might not pass the NCLEX on the first try. Remember, every person's journey is unique, and that's perfectly all right. Your story isn't going to look like your classmates, and that's okay. So what I want to talk about are what are these reasons that students commonly fail. One of them is inadequate preparation. Maybe you didn't know how to study the first time, you weren't consistent, you showed up here and there to study, but you weren't able to truly give it your all. Or maybe you were passive and not active in your prep process. The next thing, something I know I struggle with a lot, is overthinking. You start to add to the scenarios, you're constantly overthinking, and you're not sure if it's A or C because you keep adding to what is happening in the case. The third is test anxiety. Test anxiety is huge. It was something, again, that I significantly struggled with as a student, and I have seen thousands and thousands of students struggle with test anxiety, and I have seen it be the sole reason why some students do not pass their exam. For others, it may be those poor study skills. You're maybe spending 5-6 hours a day studying, but you're not doing it in ways that are effective for you. And then lastly, cramming. You can't prep for your NCLEX exam in a week. You have to give yourself more time. That's why I recommend for a repeat test taker, give yourself 9 to 12 weeks. Give yourself that time, because when you learn little bits of material over a longer period of time, going to improve retention and it's going to improve understanding. Now, I want to just take a moment to pause together. So let's just take a deep breath and let it out slowly. Sometimes we need to physically remind ourselves that it's okay to stop, that it's okay to reset, and that it's okay to begin again. Failing the NCLEX can be emotional. I have worked with thousands of students, and whenever they have failed, there are all the emotions. Some people are crying, some people are angry, some people are in shock. And I want to give you the encouragement that it's okay to give yourself grace. Not passing the NCLEX brings disappointment. It's frustrating. And sometimes it can make you feel like you are less than. Those emotions are valid, but I need you to hear me when I say this. You are not defined by a test score. You are not defined by failing the NCLEX. Nursing is not about perfection. It is about compassion. It is about growth, and it is about the ability to learn from each challenge that you face. Now, it is okay to grieve your setback if you need to. Take a week or two to work through all those emotions. For some of you, that may look like taking a day or two to step back, to rest, to let the emotions move through. For others, you might need to talk with a trusted friend, a mentor, or maybe a family member. Whatever it looks like, honor that process. You do not have to bounce back immediately. Give yourself a week or two, but at that week or two, we're going to let go of the past. We're going to learn from it. We're going to move forward to strive for our goals. Because healing is truly part of this journey. Just because you failed the NCLEX, it does not make you a lesser student. It doesn't make you less smart. It doesn't make you a lesser nurse or a lesser person. It only means that we've got more work to do before you pass. You are not in this alone. Finally, I want you to really anchor this truth in your heart. Your number of attempts does not define the nurse that you are becoming. What defines you is your persistence. What defines you is your compassion for your patients and your commitment to this calling. Whether it takes you one attempt or it takes multiple, the end result is the same. You step into your role as a nurse. And when you do, no patient has ever asked, hey, how many times did it take you to pass the NCLEX? What they see is someone who shows up for them fully, who's there for them in the hard moments, who's full of empathy and strength. So as we move forward, I invite you to shift your mindset. It's not the end of your story. This is the beginning of a new, more intentional chapter. And together, we're going to use this experience as a turning point to get you toward the success you're looking for. I want us to take a moment to just think about your previous attempts. And we really want to think about your preparation. What worked? What didn't work? Because clearly we need to redefine how we're doing this. So first of all, what worked? What study methods are you like, yes, I always understood it when I studied this way, or I constantly scored really high in this content area? Did you manage your time effectively during practice sessions? Those are the things I want you to reflect on for what worked. But then what didn't work? Were there areas that you felt like you never reached understanding, but that you were more focused on memorization? Were there topics that you avoided? Pharmacology, hint, hint, because you're like, oh my goodness, I don't like to study this topic. It's a hard one for me. Were distractions, or maybe you had burnout, was that a barrier for you? Because when you're inconsistent and you're studying, it's like going to the gym once a month. I'm not going to make progress when I'm only showing up here and there. I have to show up consistently, even when it's hard. And then next steps, when you have done this reflection, I want you to keep the strategies that worked well for you. Keep doing those. But if there are strategies that didn't work for you, that's okay. Replace them and adjust them. Because how you learn isn't the same as how I learn, and it's not the same how others learn. And we have to customize this experience so that we can make the most of it. You want to make sure you have a balanced, realistic plan for your next attempt. Something I see students struggle with time and time again is test anxiety. So what is test anxiety? Well, it is a performance stressor, and it's really common in nursing school, but where I see it even more is on the NCLEX because it's this high stakes exam. And what can happen is because we have this high stakes exam, it causes us to build and build our anxiety until we get into our fight, flight, or freeze. And when we're here, what happens is we go into what is called thought blocking. This is maybe where you felt like, oh my goodness, I can't remember anything. My brain is blank. That's because you're in that thought blocking period. Now, I want you to take a moment to think through what are some of your causes of test anxiety if you struggle with this. For me, I had a major fear of failure and a need for perfection. For others, it may be that you've accepted a job and your job is reliant on you passing. It may be that your family needs this financially. It could be that all your other classmates have passed and you haven't tested yet. You're maybe stuck in this comparison game. Or maybe it's a relative or a family member or a loved one that's saying, hey, Rachel, haven't you tested yet? Haven't you taken your NCLEX yet? And so if those are your stressors, I want you to think about how heavy that load might get. Because every time you have one of those stressors, it's like taking a backpack and I'm going to go do a hike and I add a rock in that backpack. The load gets heavy. And so I want to ask you today to lighten that load a little bit, to allow yourself to be in the learning period, to give yourself that grace. Now, with test anxiety, there are several ways that we can work to prevent test anxiety. If you have this, I don't expect it to go to zero, but what I do hope for is that you can be in control of it instead of it in control of you. So how can you work to prevent this? Adequate studying and reviewing. You want to be consistent in the review period. What you're going to notice is as you do this, it's going to help build your confidence. Because what I see time and time again is those with a lack of confidence have a higher level of test anxiety. And so if we can build that confidence, we can level set with that test anxiety so that you're in control of it. Make sure you know how exam day works, what clothes you're going to wear, where you need to park, what traffic's going to be like, all of those things, so that when you go in, there's no surprises, there's no add-ons to your stress. And make sure you know what your signs and symptoms are of test anxiety. I get really red, like the color of my blazer. I get sweaty, I get tachycardic, and then I feel like I can't sit still. For you, it may be that you're nauseous. It may be that you experience different emotions, or you start to feel like you might pass out. Whatever it is for you, know those so that you know when to combat it. Now, we can work to combat our test anxiety before the exam. We do this with adequate preparation. We can do mock exams. The goal for Archer is that you get 4 highs or very highs consecutively on readiness assessments. It's also really helpful if you get 1 or 2 past CATs. But when you do this, that builds your confidence, okay? And seek support. It is okay to reach out to one of our tutors. It is okay to reach out to an old instructor or from a friend. When you need support, when you're feeling that lack of confidence, like you just need a little more encouragement, let someone know. They can cheer you on. And I want you to start reframing your mind with what's called positive self-talk. If I were to guess, you probably sometimes have self-doubt. Am I worthy of this? Am I capable of this? But if your friend came to you with those same self-doubts, you would tell them, yes, you can do this. You've got this. You cheer them on. I want you to start cheering yourself on that same way. You are capable, you are worthy, and you can do this. Get rid of that negative mindset. And as soon as those thoughts come in, replace them. Work on deep breathing. What this does is it actually puts pressure on your vagus nerve. It will remove you from your fight or flight so you can critically think again. Because when you're in your fight or flight or freeze, you cannot critically think. If you've ever felt like, oh, I just need to get out of this test, or, oh my goodness, I can't move forward in the test, that's because you're in your fight, flight, or freeze. Now, after you've taken those deep breaths, then I want you to tense up your shoulders and relax them. And redirect your focus. Take it one question at a time. I always tell my students, plan for 150 questions. Take a break at question 86 and again at 115. Focus each question as its own. Don't try to self-evaluate. Because when you start to self-evaluate, that can build your test anxiety. And then I want you to look back at your CPR. Because looking back at your CPR is really important. You're going to see 3 different categories. You're going to have above passing, near passing, and below passing. What I recommend you do is get a big notebook. I want you to divide it by the areas that you see on your candidate performance report. For your above passing areas, I would put those all at the start of your notebook and put green tabs. Maybe do 5 to 10 practice questions on these a week. You're just trying to stay sharp in them. You can use these as warm-up questions before you get to the hard topics. Then you're going to see this yellow category. That's what I want you to label with near passing. That's going to go into the middle of your notebook. And here I want you to focus more into the smaller sections, like management of care. You need to look at delegation, prioritization, legal and ethical principles. And here I want you to start doing subtopic questions, where you're maybe doing 10 to 15 questions in those subtopics. You're really working to just level up a little bit in those areas. And then the final portion of your notebook is going to be those below passing areas. This is where you're going to do really thorough, deep content review. You really want to focus on understanding, not as much on memorization. You can do this through doing concept maps, creating scenarios. Teaching back to a peer or a tutor is super helpful. Talk through these concepts out loud. It can make a huge difference. And how do you know that you can take your next attempt with confidence? Well, you can use Archer for success. When you go through our question bank, there's over 3,000 practice questions. As you go through these, I want you to read the rationales out loud. Why are each of them right? And make sure you do that in your own words. When you take notes on something, give yourself just one line. Don't write a book, just one line of what did you miss? What was the key concept you needed to know? And make sure you're building in weekly time to review those notes because it's so important that you're consistently seeing those topics. When you're going through the videos, you don't want to do this passively. You want to do so actively. So after those little mini topics, I want you to pause and reflect. Ask yourself, were there any key NCLEX takeaways that I need to know? Could I explain this topic to somebody else? If you cannot explain it out loud, you do not truly have that concept down. And lastly, make sure that you do remediation. Remediation is essential for you being successful. We can't just go through the motions, right? I could go to the gym. I could sit there for 90 minutes, but if I'm just going through the motion, not intentional, I'm not engaging the right muscles, I'm not going to see that progress. So you have to remediate. You have to identify these are my gaps. And then you need to go study those. You need to do a deep dive into those concepts and then retake questions over them. And this is how you move beyond memorization into that understanding where it's going to improve your critical thinking and your clinical judgment. And then lastly, we do what's called a self-assessment. And this is crucial on your journey. Ask yourself, what are you going to do differently this time? Accountability and consistency are your best allies. Consider what methods you would use to hold yourself accountable when things might get challenging. Because there are going to be challenges, but you still need to stay accountable. And when you struggle with motivation, because we all have hard days, on days that we're just like, oh my goodness, I can't study today. I want you to write your why on a Post-it note. Put it in your study area and go back to that when things are tough. It is a powerful motivator. And on those hard days, keep the momentum by at least doing something. Watch a pod pulse. Those are podcasts done by our chief nursing officer, Morgan Taylor. They're amazing. Tackle 25 practice questions. Go through some flashcards. Review your notes. Make sure you're doing something on those hard days. And the big thing is when you're using one of our study plans, don't move on to the next day until you finish the day that you're on. Remember, every small step counts and brings you closer to your goals. My best recommendation is to consider our Sure Pass package because that's what's going to get you the videos, the Q bank. It's going to get you live lectures. You're going to have everything you need. You need a comprehensive prep. It's so important. And that's what can truly make the difference. And I want to leave you with, I know failing the NCLEX is hard. It can leave you questioning yourself and your abilities and even your future. But I need you to hear me clearly. This exam doesn't define you. So don't carry that weight on you anymore. Let go of that weight. It does not erase the care that you've shown, the hours you have studied, or the calling that has brought you here. This setback is not proof that you can't do it. It is simply showing you that you need a new path forward, and that is okay. Many nurses have stood where you are right now, and they went on to pass, and they went on to thrive in their careers. I want you to think of this moment as a pause, a chance to reflect, to adjust, and to come back even stronger. Setbacks refine you, but comebacks are what define you. And your comeback, your moment of success, it's still ahead. And we here at Archer are rooting for you every single step of the way. If you need anything, please reach out. We're here to support you, encourage you, and we can't wait to have you join us in the nursing profession.